Morning, guys. Welcome to my YouTube channel. And if you haven't seen me before, my name's Julie. I'm 53 and I was born with spina bifida, other disabilities, and also I had a heart attack 2 years ago when I was 51. I'm just giving you an update for those who've been following my health vlogs. I was started on Atorvastain for my cholesterol levels. And also I started on bisoprolol because I'm starting to have chest pains again and out of breath, as you can hear. They're not sure what's causing the chest pains, but it's exactly the same chest pains that I had when I had my heart attack. So obviously I contacted the doctor, started Atorvastain, like I said, and bisoprolol. Atorvastain caused the most horrific side effects. They caused every joint to hurt, every muscle to hurt. I persevered with the tablets for a month. Side effects were just getting worse and worse. I was constantly absolutely shattered, in more pain than ever. So I spoke to my GP and the pharmacist, and they advised me to stop the Atorvastain, which I'm really glad about. I've been stopped the Atorvastain now for a week and all the side effects have gone. No more pains in my joints or muscles. No more blurry vision. So I really feel sorry for any of you that are on statins because the side effects are horrific. My cholesterol level's still high, but I'm working on my diet to get my cholesterol level lower. But I definitely won't be taking any more statins. It just caused the side effects were worse, and I can't be dealing with that. The bisoprolol, been on that now for about three weeks. This is my third week. I was putting down the tiredness to the bisoprolol, but having stopped the Atorvastain, and I realise it was that was causing all the side effects. Actually feel okay today. I'm still a little bit tired, but not as bad as I have been. So I'm going to continue taking the bisoprolol. I went for some blood tests on the 10th, Monday, and the nurse advised me that they want to increase the heart tablet. Well, they want to double it, actually. So I was a bit like, oh, let me get used to the side effects of the bisoprolol before I double it. I need to get my body just feeling a bit healthier before they double it, because the problem is the heart tablets slow everything down. It's a beta blocker, so it slows your breathing down, it slows your heart down, which makes your lungs, you just become more out of breath. Well, because I've got spina bifida and scoliosis, my left lung doesn't work anyway. So adding that tablet to the concoction, my left lung, I'm really struggling to breathe at the moment. I'm out of breath walking, out of breath talking. So again, I've spoke to the pharmacist and the doctor, and he said that my lungs will get used to the beta blockers and my breathing should improve. So I want to give my lungs chance to get used to the heart medication before they double it, because I just think I need to get my lungs used to the medication first. So I've got to go back in 2 weeks, and then we'll discuss about increasing the heart beta blocker then. I've had Frankie, it's my parrot. I've had I've been waiting to see a heart specialist. I've had a letter from the hospital saying that they'll do a telephone consultation. So the heart specialist is going to phone me. Bit frustrated that I can't actually go in and see somebody, but I suppose a telephone call's better than nothing. With this COVID, it's such a pain in the arse that people aren't getting hospital appointments and not actually being seen by specialists. I feel so sorry for people who are going through cancer, or there must be so many people who are not getting diagnosed, etc., etc. And my heart goes out to everybody that's going through that at the moment. It's bad enough when you've got a heart condition and you try to see somebody. So anyway, they're going to phone me on the 9th of February. So hopefully we'll be able to discuss what's going on with me. Because obviously, I don't know if some of you are aware that I did claps on New Year's Day, which was a new thing. I got in an argument with my ex-boyfriend. It's a really complicated situation. We're still living together. I ended the relationship because a few things that he's done that I'm just not going to put up with anymore. But because we own the house together, we're literally stuck sharing the same house. And I'm just not well enough to move. And my attitude is, why should I move when I've done nothing wrong in the relationship? See, I'm getting out of breath now, as you can see. So obviously we got into an argument on New Year's Day. And when you get into an argument, you get irate, don't you? You shout, you rant, you scream or whatever. And I don't know if the stress of me ranting, shouting, screaming put extra pressure on my heart, and I just collapsed, which is a totally new thing for me, which did scare me a little bit. So it'd be interesting to see what the heart specialist says. So I'm looking forward to that appointment. Also, because of the spina bifida, I have problems with my bladder and bowel. So I'm actually going to the hospital to an attend appointment on Wednesday regarding my bladder. They keep wanting to do tests on me, but every time I go to have these tests done, I've got a urine infection. I've just constantly got a urine infection. Take antibiotics, finish them. 2 days later, I've got another urine infection. So, but that is an ongoing thing with spina bifida. You do suffer with your bladder and your bowel. I've always suffered all my life with my bladder and my bowel. So that's where I am health-wise at the moment. Still out of breath, which is hard work because you're using more energy just to breathe normally. So that makes you tired. It's just horrible. You just sometimes feel like I'm trapped in an 80-year-old's body. But hopefully, fingers crossed, that side effect will sort itself out. And then they'll double them. And then let's just see how I get on then. That's it really. That's just an health update. I'm going to be doing some skincare videos this afternoon. Just putting my skincare routines up and what I use on my aging 53-year-old skin. God knows what I'm going to do with my hair. I don't know to have it all cut off or what to do with it. It's just looking so messy at the moment. And my eyes are still puffy and baggy. God, look at the state of me. Anyway, guys, that's a quick update. Hope everybody has a good day. Please like, share and subscribe, and I'll catch up with you again later. Bye.